Hello and welcome to a special live discussion from the USA Today Network Atlantic Group. No region of the nation has had more COVID-19 deaths than the Northeast, led by 32,600 in New York, including 4,600 probable deaths in New York City and 15,700 in New Jersey. But the death toll, which includes another 8,500 in Massachusetts, 7,100 in Pennsylvania, about 3,500 deaths in Maryland, and 580 in Delaware, has largely subsided in the Northeast as social distancing orders, a slow reopening, and required mask wearing has proved effective. Now the question is, what worked and what didn't? And what can states do to avoid a so-called second wave in August and into the fall? Here to discuss their findings in our Gannett Atlantic series that launched on Tuesday titled COVID, What's Next? Are reporters from across our papers. Joe Spector from the USA Today Network New York state editor, and from NorthJersey.com reporter Scott Fallon and healthcare reporter Lindy Washburn. The series looks at all facets of the state's reopening and what's next, whether it be for the hospitals, contract tracing, or schools. Thank you everyone for joining us today, and let's just start by asking, why did the Northeast get hit first with the coronavirus pandemic, and was the region particularly ill-prepared?
Yeah, well, thanks, Ryan, and thanks for having us. That's the real issue here, right? I mean, you look at the timeline, and starting New York had its first case March 1st, and I believe New Jersey was soon thereafter, in around the same time. And Governor Cuomo was put in New York, and similarly in New Jersey, they put it on Europeans coming from Europe into New York and into the tri-state area, bringing the virus with them. Now, others will say, as a result, New York, New Jersey, Connecticut, and other states should have shut it down quicker, should have shut down their businesses to non-essential workers earlier in March. New York didn't do so until March 22nd. It closed schools a week or so earlier than that. But there was a report that came out from Columbia University that said if New York City had shut its businesses and schools down in early March, it could have saved 17,000 lives. And, you know, that number's been disputed, but the issue is the same and the debate is the same, whether or not an earlier shutdown would have prevented many of the deaths that you noted so tragically in your opening.
I think another reason was that the United States had a policy of just screening visitors coming from China and wasn't really attentive to the possibility that the disease could be coming from Europe as well. And the screening only took place at certain airports and was really focused on people who had fevers and initially who came from a certain province in China. There was no recognition that people could enter the country who weren't showing signs of illness and yet could still spread it. So before anyone even knew what was happening, the disease was here and it was spreading, and it was moving unseen through a large part of the metropolitan area population, landing in New Jersey with the first case on March 4th, as Joe said.
And it's also demographics. I mean, listen, we are the most densely populated area in the country and perhaps the world. New Jersey's the most densely populated state in the nation. We rely on communal activities, mass transit. This is a region, the metropolitan region, that relies on mass transit, subways, buses. We're together a lot. We're just together wherever we are, wherever we go. That's just the makeup of the region, and it provides the perfect place for a virus to spread.
And let's talk too about the steps that worked and didn't work to quell the spread of the virus in the Northeast. Lindy, of course, you were covering the hospital, Scott with the nursing homes, and Joe with hard-hit New York. So what are some steps that were taken, and what worked and what really kind of failed during this?
I think one of the failures that we've really identified now in retrospect is the reluctance to mask up, the reluctance to have even the general population put masks on. That would have so limited the spread of the disease by people who weren't feverish and who weren't obviously ill. Even in healthcare settings and in hospitals and nursing homes, the employees were told, don't wear masks, it will scare the patients. And if they had, I think that would have made a big difference in how widespread this had become or how quickly it would have spread.
That's a good point, Lindsay. You think about to those early days in March, and it wasn't even recommendation from the CDC that people should wear masks. I think New York put in its mandated mask protocol in mid-April, and it just was that debate about how effective masks could be. I mean, you're showing some file footage there, but it goes to the point of how little our region knew about the virus since we were the first ones to have to deal with it. And that led to a lot of learning on the fly that other states either did follow or didn't follow, as we now see the virus in other parts of the country. And we'll talk more about this. But now the question is how we, as you noted, Ryan, how we prepare for another spike potentially in August and into the fall.
And I think a question, too, on a lot of people's minds during all of this is, where does the blame lie? We've kind of seen this back and forth playing out amongst politicians in the news. Does the blame lie with the state and local government? Does it lie with the federal government? Or is it some kind of combination of both?
Well, in places, in countries that have been able to stem the spread very effectively, the number of cases and the number of deaths, they had a national plan to do that. In the case of the United States, it was really left up state by state with some guidance from the CDC. But there was no national plan for this. And the lack of one creates this hodgepodge where you have places like the Northeast, like New York and New Jersey, which clamped down pretty fast in March and April and into May. And you have others that didn't or did much less. And you have those hotspots coming out now in Florida, South Carolina, Texas, and elsewhere throughout the country.
Yeah, that's a good point, Scott. And that really led the Northeast states to try to come together and come up with their own plan, what they viewed was a lack of a federal plan. So you talk about the quarantine now, a 14-day quarantine for people who come in from 34 states. And that's the result of the efforts of New York, New Jersey, and Connecticut to say, you know what, if we're going to limit the spread and not have it come back significantly in the next few months, we have to join together and have our own quarantine. And we have a story posted today about how that's worked. And what's interesting is that it's led to a huge decline, 70, 80% decline in people taking planes out of New York and New Jersey to other states because they don't want to go and then come back and have to quarantine for 14 days. So you're really seeing a shift in how people handle travel this summer as a result of that quarantine.
Yeah. The failure of national policy was also felt in the lack of resources to produce the personal protective equipment that was in such short supply at healthcare institutions. And if there had been, a lot of people have said that if there had been a use of the Defense Production Act, that the shortages of those supplies, as well as the ventilators that were so desperately needed to help patients who are critically ill to breathe, might have been averted. As it was, different states were bidding against each other and sending the prices up higher and higher with the PPE. And, this was kind of an unnecessary sideshow. The other thing that was in short supply and continues to be in short supply is the testing supplies. And so some national leadership in that area would have been better. Of course, we all know that the month of March and February was pretty much lost because of the poor, the problems with the tests that were sent out by the CDC. But to this date, there's really not a national testing policy or, a national manufacturing policy for all the ingredients that test kits need.
Yeah, what are you seeing in New Jersey? Because New York, it's been a mix in terms of the fact that there's so much more testing needed across the nation. For a while, New York is testing 50, 60,000 people a day. The infection rates are around 1%. But it's interesting in that people are starting to say that their test results are taking longer to get back, particularly if they're sent to like a national company for the results, whereas tests that are done by state-run facilities are coming back sooner. But it's such a mix in what we're hearing.
Yeah, so I was just on another call before this where hospital executives were saying that, it was getting up last week to 7 to 9 days to get test results back. And once you get into that long of a turnaround time, the efforts to control the spread of the virus are just moot because people are moving around and contact tracing is, not even effective. Now it's gotten down less, but the issue is going to be that we need so many more tests to be done. If schools are reopening, if, as hospitals try to ramp up and increase the elective cases that they do, as businesses reopen, frequent tests are going to be necessary. And if you don't have the resources to do that, it really hampers the economic reopening.
I spoke to a nurse last week or the week before. Her daughter got a COVID test. They were waiting for 9 days for the results. That nurse was not allowed to return to work until the test results were in. So basically, you take a nurse offline who can't work because the test result from her daughter hasn't come back yet. So there's real implications for the turnaround. And Governor Phil Murphy of New Jersey, who's not one to get animated really at all, last week came out and his quote was, "This turnaround sucks."
Mm-hmm.
Yeah, and was that had it always been that long, or did that get worse as a result?
Oh, not at all. I mean, it's the explosion of cases elsewhere in the country that's really delaying the results coming back from the commercial laboratories. A lot of the hospitals have established their own testing capacity, their own laboratories to do it. But if they can't get the ingredients, these chemicals that separate out virus particles, they're called reagents, then they're hamstrung too. So in New Jersey, they're going to spend, the state got federal money, $94 million to try to upgrade the in-state capacity at different hospital laboratories and private laboratories to not have to rely on those outside laboratories like Quest and BioReference that are just jammed right now as cases surge in other parts of the country.
That's very interesting.
And again, you're watching a special live broadcast discussing the series COVID What's Next. You can read it on loha.com, northjersey.com, app.com, and across the sites and papers of the USA Today Network, Atlantic Group. Let's talk about the data in tracking this virus and tracking this spread and really just all of the statistics that have been thrown at us the last few months. How difficult has that been? Lindy, you've been covering the hospitals, Scott, the nursing homes, and Joe, of course, in New York. How difficult has it been to get the data and get the details from the states where the virus has been hitting?
So we found a lot of data has been added as the pandemic has progressed. And now, there's a very complete data dashboard that the New Jersey state government puts out. But at least initially, there was a terrible lack of information for nursing homes because no visitors were allowed. There was a clampdown on that fairly early in March. And families were desperate for information, and no names of nursing homes were released to indicate whether there was an outbreak or how extensive the outbreak was. Eventually, that was remedied, and the state did start releasing that information. But there have been a number of different, battles over time to get more and more information out. Right now, what I'm interested in getting and haven't been able to really is what supply of PPE is in hand in the state and what has been distributed to hospitals. We know that stuff came in from the state stockpile and that millions of dollars were invested by the state to buy PPE, and yet there's no way to trace, did this actually get into the hands of the frontline workers to protect them?
That's a really good point, Lindsay. And it had, you think about a few months ago and how difficult it was for us as journalists to get vital information to provide that to the public. How many nursing home deaths there even were, let alone have a breakdown by facility, which we ultimately were able to get. We wrote collectively all together here. We wrote stories about the Northeast and the struggles in getting data. And, we were able to help move the ball along, I think, in getting that information released, because it was a struggle. And now all the states have these dashboards. But yeah, we're still not completely there, particularly when it comes to nursing home deaths in cases. The state put out a report about this controversial March 25th directive that made nursing home patients with COVID go back to their facilities rather than to stay in the hospital, and that made it difficult for them to know how many people were dying in nursing homes as opposed to dying in hospitals, and that continues to be an issue. We don't know how many of those people who were transferred to nursing homes died in hospitals or in nursing homes. The total now is 6,500. But that is the result of only knowing that those people who died in nursing homes, not in hospitals. So there's a lot of information that still is out there that we would like to know.
Yeah, and just to take it to a very granular level, there was a case with a state-run veterans home in Paramus in New Jersey, in which Lindy and I heard that a staffer, a certified nurse's assistant, had died there. The state said no staffer had died, yet the union said the staffer had died. His coworkers said the staffer had died, and then we confirmed with the family that the staffer had died. And it wasn't until we wrote a story about it that the state acknowledged that, yes, one of their employees, a nurse's assistant who was treating very elderly, very fragile residents of this veterans home, had died from COVID-19.
And Scott, sticking with nursing homes, I think a lot of the public realizes how hard hit nursing homes, especially in New York and New Jersey, were hit by this virus. Why was that? Why were nursing homes hit the way they were with the number of deaths, especially in New Jersey, that we saw? And was this the result of some questionable decisions made by leaders?
Well, it's been an absolute catastrophe in New Jersey. Let's not mince words. So you have 6,700, at least 6,700 residents of nursing homes have died. 119 staffers have died. That's half of the death toll that COVID-19 has enacted in New Jersey. And if you take it out to a bigger level, that's 5% of all deaths in America were New Jersey nursing home residents or staffers. To me, that's staggering. New Jersey has a lot of nursing homes. New Jersey is densely populated. There were a lot of questionable decisions that were done at the outset of this. For instance, PPE supplies. PPE supplies were prioritized for hospitals, not for nursing homes. The state's own report says, in New Jersey, says that Governor Murphy's administration prioritized hospitals over nursing homes. The idea of universal masking, that every staffer should have a mask, that every resident should have a mask. That didn't come until almost a month into this pandemic. It was a suggestion, not a mandate in New Jersey. Then you have what Joe alluded to, was the taking COVID patients who were sent to hospitals and putting them back into nursing homes. Now, that has been very controversial. That has gotten a lot of chatter on social media and has been something that Governor Murphy has defended his health department against. The health department put out a statement in late March to nursing homes, a mandate: you must take these back. But the priority or the bar was that they have to be medically stable. It didn't say they had to be COVID-free, just medically stable. It wasn't until 2 weeks later that another mandate came out that says you can only take them back if you can quarantine them, if you can cohort them, if you have a separate wing to put these residents in. How much damage that did in those 2 weeks, it's not yet known, but certainly a lot of people feel that this was not the right decision. At the time, this was right before the surge. The projections were still very bad, very dire. They didn't come to fruition, but the idea was to free up those hospital beds for patients.
Another issue that affected the nursing homes was the fact that many of the staff that work there in direct patient care, the most intimate things, bathing, feeding the residents of those nursing homes, have multiple jobs. And they would take the disease from one nursing home to another because the wages are not enough to really support them from one place.
Yeah, that's a
very low wage.
It's you can't. What they found what was difficult is you can't put the COVID patients on the third floor and then have the rest of the people on the second floor, and have the same staff going up the third floor and down to the second floor, as we've heard reports of, and that you're dealing with the most vulnerable population, as everyone noted, and it could really spread, as Cuomo said, like wildfire in those facilities. But at the same time, while the states talked about how vulnerable nursing homes were, there's a lot of criticism that they didn't do enough to protect those people, particularly in those first few months.
Yeah, we should have seen it coming, really. Remember Seattle and that Kirkland nursing home, and everybody in the United States was watching appalled as the cases spread there. And then you just had that experience repeated over and over again in so many nursing homes. Even to this day, there's more than 300 nursing homes in New Jersey that have outbreaks, which is defined as, more than one case. And so the handwriting was on the wall, but I think there was almost a failure of imagination, like it couldn't possibly get as bad as it did. People, weren't expecting that it would just be so deadly and so quickly transmitted to as many people as it was.
Yeah, there were just days we were reporting on it. There's as many as 800 deaths a day in New York in late March, early April. And, I was keeping this spreadsheet every day of just a line chart, and to put in 800 or so every day. You just couldn't believe you were tallying those kind of numbers.
Right. And to me, one of the biggest omissions really is that healthcare workers were not, they were not protected, but their sacrifices, the loss of life among healthcare workers has not really been tallied by anyone in a position of authority. They aren't being recognized, nor are they really being compensated. So many of the families that I've talked to now face medical bills for people who died in the line of duty. And it strikes me that this is an error that needs to be corrected.
Yeah, and then to add to people's frustrations is that our states, New York, New Jersey, and others, passed laws that limit the legal liability for nursing homes and hospitals, where if you had a loved one who died in these facilities, you really have to prove gross negligence to be able to have a lawsuit that could be effective or successful in the courts. And that is an issue that New York just passed a law. It would have to be signed by the governor that does give loved ones a little more flexibility in what type of lawsuits they could bring. And you're seeing that also play out on a national level as part of this new stimulus package. Republicans want to protect hospitals a little more. So yeah, this is a little bit of the aftermath of what we've seen over the last few months.
Right.
By now, Kirkland, Washington, when it was a national tragedy when they had 36 residents dead. In New Jersey, we have some that are double, triple that amount already.
Right.
Yeah, good point.
Right.
And again, you're watching the special live broadcast here discussing the series COVID What's Next. It premiered on Tuesday and will run through early August. And of course, you can read all the articles across the papers of the USA Today Network Northeast. Now let's talk about the future and preparing for a possible second wave or a spike in cases as they're currently soaring in other parts of the country. What are the states doing around here in the Northeast to try to keep the virus at their borders?
Well, the most important and obvious thing is that they're trying to prevent or anyone coming from another state that's a hot spot is being asked or required to self-quarantine for 2 weeks to avoid that spread. So that's one feature of it. And then, of course, the very, very slow reopening in New Jersey and New York.
Yeah, and that's the big question, Ryan. It's what will the fall look like as students head back to school, as colleges open? You're going to have a lot of people congregating in places where they hadn't over the last few months. People going back into the workplace, as Scott noted, people going back on the trains. I mean, it's there's so many unknowns. How can our states effectively keep these infection rates as low as they are now? It's just anyone's guess.
One of the big questions that medical people have is what is going to be the interaction of this virus with the flu virus? How severe will the flu season be? That's why they're encouraging everybody that can to get a flu shot. But there's concern that the combination of a second wave and a bad flu season could really be, quite a challenge to hospitals.
Yeah, that's a good point, Lindy. And you think about distinguishing between those two, right? People are going to go to the doctor and they might have the flu, they might have COVID. Some of the symptoms are so similar that when we talk about the need for as much testing as possible, you wonder how strained that will become when flu season hits.
Mm-hmm. Mm-hmm.
And as we've seen, the numbers in the Northeast start to come down a little bit. Does this speak to how effective these measures will have been so far, or is there still more work to be done to really diminish the cases that we've seen?
I think it shows that it's been effective, but I think there's a lot of fatigue setting in. Like, isn't this over yet? I mean, we thought it was going to last a month or two back in March. And now the need, to really still maintain these very strict precautions and not interact with your friends indoors or go to a bar or a restaurant. I mean, that is really, it gets tiresome, even for the most disciplined person. And so, I think that it's going to be hard to maintain that level of discipline and control over the spread of the virus. I think we see that also in the fact that younger people are now a much larger proportion of the positive cases. And although they don't get as ill in general, they do have the capacity to really spread it to other family members and people they come in contact with.
I mean, we may be looking back, hopefully not, but we may be looking back as this summer as a lull, as the good old days where we're still able to go outside and go to the beaches and go to parks and eat outdoors and have these little basic freedoms that a second wave may put a clamp down on, as we saw in the spring with the first wave.
Yeah, you look at the reopening in New York and New Jersey, and while it was phased, there are still some parts of the economy that haven't opened. Indoor dining in New Jersey, for example. New York hasn't opened its casinos. Indoor dining in New York City hasn't reopened. So I think you're going to see political leaders continue to reevaluate what's open and what's closed if you see these infection rates go up. New York's starting to be pretty aggressive on bars and restaurants that don't serve food and allow these kind of outdoor parties to go on at outside bars and people congregating in close quarters without masks. So that's going to be an interesting one to watch. When does it get to a level where you see Governor Murphy, Governor Cuomo, Ned Lamont in Connecticut, those three states in particular, try to dial it back if those numbers go up again?
And I'm glad you mentioned the economy, Joe, because that's obviously been a major kind of secondary talking point during all of this, the effect that COVID-19's had on the economy, both at a local and national level. What have we been seeing in our areas, in our states around the Northeast? Are you seeing improvements in the reopening and, how effective the slow openings have been? And what still remains closed and might not be opening for quite some time?
Yeah, it's that's just it. I mean, amusement parks in New York aren't open. Water parks, I think New Jersey has some level of those open now. Summer camps are open. So, it just depends on the issue. Malls, it took a while for them to open in New York. They're at limited capacity still. But there's other things that, like, New York didn't have overnight camps, for example. They didn't allow that to happen. They haven't allowed gyms to reopen at all. So, there's a lot of people who are in these sectors and are not employed. And so that's, gets back to something we talked about a little bit before about the stimulus package coming out of Washington. And, how much money, if at all, states will get to fund local governments and services. Right now, the plan doesn't include any money for governments, state governments and local governments and schools. So that is going to be a huge issue to look for as states are dealing with huge budget gaps going into next year, into the fall, and over really the next couple of years, because their revenues are just extraordinarily depleted.
I think the most important question of the moment really is what's going to happen with schools and colleges, because that is so critical in addressing the ability of parents to be able to work again. Parents who are at home and doing online virtual learning with their kids are less able to be productive in the workforce. And so the debate about that is nowhere near resolved. And similarly with colleges, we don't know whether students will be leaving, and traveling to their colleges and residing there or not. So, I mean, that's a huge uncertainty facing the economy that will need to be resolved within the next few weeks.
Yeah, parents are completely torn. I speak from personal experience. Do you go back to a hybrid model? Do you send your kid back to school at all? Do you do distant learning, knowing that there were significant challenges to that in the spring? I think hopefully this lull that we've had in the summer, in many respects, makes us able to learn what we did right and what we did wrong in the springtime, so that we can prepare for the fall, whether it's school or whether it's whether it's healthcare, whether it's hospitals, whether it's nursing homes. This is a time for reflection and a lot of work. It's not a time to lie down, because this is the time to prepare. Because, and thankfully so, in New Jersey, New York, Connecticut, and much of the Northeast, the rates are low. And compared to what's happening elsewhere in the country, we have that luxury where we can prepare for the fall, for what we believe, what the models show is a second wave.
Mm-hmm. Yeah.
Good point.
And in regards to, we mentioned them before, the hospitals and the nursing homes and kind of what went wrong there and how badly they were hit. As we look to the future, Lindy, we'll start with you in regards to the hospitals. What can they do to make themselves ready for a second wave?
Well, I was thinking as Scott was speaking, how during this lull, they're literally taking advantage of the time to kind of fortify and solidify some of the changes that they made in the midst of a crisis. When they quickly converted places like medical libraries and cafeterias and unused storage space and other kinds of offices to critical care units. Now they're making those spaces, they're kind of fixing them up and making those changes permanent. They're stockpiling PPE. They're trying to address some of the supply chain issues for all of those test ingredients that we were talking about. And most importantly, they're trying to give their staff the opportunity to recharge. I mean, the resilience of staff is really essential. It's human beings that take care of other human beings. And these people were really depleted and exhausted by just the incredible amount of death and the long hours that they saw. So that opportunity to build staff resilience is something that's important to take place over the summer. And I think many of the hospitals and nursing homes, to a lesser extent, perhaps, are trying to do that.
Yeah, that's a really good point, Lindy. You talk about what they went through, and the horror stories that we all wrote about when it comes to the staff and either losing loved ones or dying themselves or having to work these extraordinarily difficult circumstances is something that for them to have to brace for another wave of that in the fall. But like you said, it's they will be more prepared. They will have there's no question. And but again, it goes back to what we're saying: how well prepared can they be when it comes to the PPE, ventilators, all the things that they were just nobody expected. Everybody was cut off guard.
Right.
Yeah, I mean, in hospitals and in nursing home settings, you hear them. Well, we're stockpiling gowns, we're stockpiling masks. We hope that we'll have enough. We're trying to get them from here, there, and everywhere. You hear it at the state level. The state's trying to stockpile it in anticipation of a second wave. In nursing homes, they have this blueprint that they'll have in New Jersey, at least, that they'll have this emergency center. And if there's an outbreak, that they know right away that there's an outbreak at this particular nursing home, or there's an outbreak in this particular nursing home, that would allow them to better deploy resources conceivably. Lab capacity is a big deal. We've talked about that, the problems with the turnaround for lab results. New Jersey has said that they are going to test 90,000 nursing home workers each week and have a quick turnaround on the results to see if they are indeed infected with COVID and thus putting the entire home in jeopardy.
Again, you're watching the special live broadcast discussing the series COVID What's Next. You can read that on LOHUD.com, NorthJersey.com, APP.com, and across the sites, USA Today Network, Northeast. Let's wrap up on a question that I think a lot of people have in mind, and it's really impossible to answer, but I'm just curious to go around and get everyone's thoughts. How does this play out? Of course, we don't have to have a second wave if measures are taken, but I'm just curious to get everyone's thoughts of where this goes in the long term, in the short term. How do we think this plays out over the next few weeks? Lindy, we can start with you.
So I may be overly optimistic, but I do not think this is going to be as bad as it was in March and April. I think that people know what they're dealing with to a much greater extent. They're taking precautions. There's more mask wearing. It's not universal. It's not as good as it should be, but it does help to a certain extent to prevent the spread of the virus. The people who are getting sick tend to be younger, and therefore they spend less time in the hospital and are less likely to die. And we know more about treatments. We have some things that work to shorten hospital stays or to diminish the symptoms. They're not knockout punches. It's not a cure. There's not a vaccine. But I think that the clinicians are much more educated on what they should do when in treating people who get sick. So I don't think it will be quite as devastating as what we saw initially.
Yeah, people have adjusted. People work from home now, right? They've gotten accustomed to doing so. So I think what you'll see in the States is if those infection rates go up, you'll see a much more quick decision to close businesses, whether that's bars, restaurants, you name it, malls, anything that's reopened. I mean, those could, easily go back to being closed if the infection rates rise significantly. But as everyone said, schools, what's going to happen there? Can they stay open in through the fall and through a whole year? Same for colleges. I mean, those are huge questions, and those are uncharted waters. While we know what happened in hospitals and nursing homes and how they're going to adjust, is going to be a new frontier for those areas that were not open, that closed, and now will reopen in the fall, or those that have opened over the summer.
I think we are better prepared. I think that experience counts for a lot of things, and we experienced it. We never experienced this before, so certainly we have that going for us. But I also think that there's cumulative effects that are going to be felt if indeed a second wave comes and there is a second hard shutdown in the Northeast. You may have somebody who, because of COVID-19 in the spring, was out of work for a few months and then was reemployed in the summer during this lull and then becomes unemployed again. How are you going to deal with that? How are you going to deal with the lack of tax revenue at the state level and the local level? How are you going to deal with just families not getting paychecks? The unemployment insurance, the added $600, that's in question. That may not come back. There's quite a lot of questions that are going to be dealt with if indeed there is a second wave and if indeed we do have to shut down.
Well, thank you all for sharing with us today, and thank you for everyone who's been watching along with us this afternoon. Thank you for tuning in. Our thanks to Joe, Scott, and Lindy. Thank you all for your great work on this series, and thanks for speaking with us today. Our thanks to Mike Pedagano as well behind the scenes for running the show. Please read the series COVID What's Next, which started publishing on Tuesday and will continue through early August across the sites of the USA Today Network Northeast. Thank you for joining us this afternoon. I'm Ryan Ross, and we'll talk to you next time.